Hi, everybody. Welcome back to the Super Mom School podcast. I'm delighted to have you on listening today. Today, we have special guest Kori Orth. She's a wife and a mom to 3 little kids. She's a registered nurse who turned to integrative health practitioner and a life coach. In her bio, she says that after years of working in the conventional health setting and becoming frustrated with a broken system that left many of her patients with few solutions, she has become passionate about helping moms move forward from overwhelm and fatigue to health and wholeness. Kori, thank you so much for joining us on the podcast today, and welcome.
Thank you, Mary. I'm excited to be here. I'm excited to be able to chat with you on this.
Yeah, I tell you, this is a subject that's just personally near and dear to my heart, because I can totally relate to this idea of you've been to the doctors, you've been to the regular system, they don't have the answer. Everything they've given you is not working. and now what do I do? And
it leaves you feeling like, is this just in my head? Because that's what they're leading towards. And it's like, no, like, your body, there's more going on. And it's like, there is an answer. There's a solution for sure.
Absolutely. Yeah. So tell me a little bit about your background. How did you get, because that's my story. That's not what we're here to talk about today.
Two extremes.
Yes. Let's talk about what led you down this path, and how did you get there? And a little bit about yourself, your family.
All right. So yeah. Okay. So like you said, I'm going to be married for 12 years this May. To my husband, Dan, and we've got 3 kiddos. They're younger. So I have a 5-year-old, just turned 4-year-old, and a 1-year-old. So there's no dull moments in our house. So all good things. And my background's in nursing and then nurse education as well. So most of my time I spent working in an emergency room outside. We live outside of Philadelphia, like in the suburbs. So I was in a pretty busy emergency room, seeing a lot of adults and kids, where I spent most of my nursing career. And just kind of, that was my baby, so to say. It's like, I was involved, like orienting, doing educational programs, like leading unit council. Like I love the ER, I love the environment. And then something just shifted in me, like when I had kids. And I just remember like starting to dread going into work. I was doing off hours because my husband was working during the day, and we were just kind of making it work by doing off shifts. And like, I remember just hitting the point, like, I'm done with this. Like, I think just the frustration, like I had shared in my bio, you just see like the same old problems, the same old, ideas of sharing, but nothing ever gets like resolution to it. And it was just discouraging, because I'm like, there can be so much more that we could be doing for our patients.
I want to like get into this. Like, can you give some examples for the listeners? Like when you say you saw the same thing over and over again, that was like frustrating. Can you give some examples of what those things are that you would see? Because we don't get that perspective, right? We just think we're
right, absolutely,
with our one thing.
Yeah. So I think the things that come to my mind most frequently, and like I worked evening night shifts. So like I'd be there till either 3 a.m. in the morning, 5 a.m. in the morning. And it's always interesting what kind of walks in the door, those off hours of the night. But so many like people we'd see with just like belly pain, someone who would have abdominal pain for months, sometimes years on end. And, for some reason at 2 a.m., they've had multiple GI workups, never got an answer, and they come into the ER with that. Or, I'm just thinking too, like skin rashes for kids, this itchy rash that all of a sudden at 4 a.m. it's an issue. We've been seeing someone tried multiple different things and it's not working. And you understand, it's like at that moment in time, that is an emergency to that person. Like it's impacting their quality of life, everything that's going on, and just being able to look at it through their eyes, but just to be discouraged to come and I'd be discharging these people and you'd see the tears in their eyes, because they're like, I keep on hearing this and I'm not making this up. It's there. And just feeling like hurt and discouraged for them.
Wow.
So,
yeah.
And that was so fine. I had my oldest 2, they were 3 and going on 2 at the time, or going on 1, I think, and just kind of had all right, I'm done with this, and transitioned into a rheumatology office. Loved the pace, loved my patients, being able to care for them. I was doing infusions for arthritis. And I remember just one day hitting a point and being like, wait, this is like all that we have to offer them. And I refused to believe that some of these patients were going to be on these medications for the rest of their life, because there was no other solution for it, that, on a monthly basis for the rest of their life, they were going to be coming in for that. And so that kind of, I mean, one of a few things that started to send me down this other path of like, what else is available? Like, I'm not going to believe that this is the only option. I truly, that God's created our body to heal, and to be in balance and kind of restore itself. Like, how can we make that happen? So that, I think, was kind of the launching point of looking into this integrative health and seeing, okay, what else can we be doing? What can I be learning to be able to better serve my patients that I'm caring for?
Yeah, that's a beautiful, I can see how you would make that transition so quickly to that place. And I want to latch onto something that you said that I think we can all resonate with, is that realization at some point that I think we all eventually get to, of sort of recognizing, wait, the medicine isn't actually solving a problem. It's
Right.
just masking a symptom of the problem. We're not
Exactly.
actually fixing anything. We're
Right.
just
You're just suppressing it
we're
or masking
suppressing
it, like
it.
you said.
Yeah. We're just addressing, like, making it tolerable. We're tolerating it rather than solving a problem. And yeah, you're right. When we realize that, it's like, okay.
It's like this big light bulb goes off. And it's like, I just remember in nursing school, and then like I worked in nursing education, like teaching this. It's like you look for that collection of symptoms that then give you like that name. Everyone wants that diagnosis of what is the name, and then because once we have a name, then we can give a medication for it, or we can give, an intervention for it, like a treatment, or like surgical, something like that. And it's like, but no one ever asks well, why? Like, why are these symptoms happening? Like, what if symptoms were kind of that check engine light in your body coming on saying, hey, like, I'm not okay here. Something's going on. What if we just ask why that's happening? And what does that unlock, like, by asking that question?
Well, and it makes me think of, to follow your analogy, it makes me think of the man who sees the check engine light on. He's like, oh, I can show you how to turn that off so it's not bugging you on the dash. And like, you just go and disconnect it from the, like,
but it doesn't take care of the problem.
I think that that's really the answer to the,
And it happens. Or like I think a good analogy for that is just like, okay, your check engine light's on. It's like, you wouldn't take a piece of tape and put it over it and be like, no longer a problem. But in a sense, like, that's what, sometimes
now I don't have to look at it.
Work is, right.
Yes.
Out of sight, out of mind. It's all good. Until one thing leads to another.
Yeah. Yeah. All right. So back to your story. So you were doing the rheumatoid arthritis infusions. You decided, okay, not doing
something more is going on.
We got to do something different. So take us from that place. Where did you go next?
All right. So that was, I'm thinking like November, December of 19. I'm like, I want to do something different, and really started to dive into kind of this integrative health, holistic medicine, started to follow different people on Instagram, read more about physicians practicing this model of health. And I'd found some certification programs that really looked interesting to me. I'm like, oh, I really want to do this. Mind you, at the time I had a just turned 3 and a 1-year-old at home. And I'm like, maybe later. I'm like, life's too busy right now. Working part-time, taking care of them. And I remember like, it was February of 2020. I just hit a point. I'm like, you know what? Life is always going to be busy. One busy is going to turn into a different type of busy. I'm like, this is important to me. I want to do it now. And it was literally the week before COVID like struck, and our life kind of changed as we knew it. Like, I signed up for that course to begin the Integrative Health Practitioner certification. Wow. So to say like God's hand was on this and timing was everything, it truly was.
Wow. So for our listeners, I know some people are familiar with integrative health, but some people aren't. Can you kind of give a definition or description of what that actually means? What is integrative health, functional medicine? How is it different from normal medicine?
Yeah, absolutely. Good question. So kind of traditional medicine that we're all familiar with, that Western medicine or conventional medicine, you go to the doctor, I think I mentioned before, and we're looking at what are your symptoms and what can we label it with? And then kind of what can we follow through with? And you'll get a little bit of like, oh, you have high cholesterol or high blood pressure. Let's try diet. And then when that doesn't work in 3 months, we're going to put you on these meds to kind of manage that. So that's kind of that conventional medicine setting or the Western medicine setting. What I do as an integrative health practitioner is really going a step farther and like asking why, kind of taking that onion and peeling back the layers of what's going on here. We're asking why a couple more times, what is the root of the problem that's causing the symptoms that someone is experiencing? So for example, if a kiddo has something like eczema, like this dry, itchy skin, that's kind of your body's your largest organ. And a lot of times it is looking what's happening in the body that's out of balance, that's then creating that reaction. So a lot of times kids who have eczema, there's actually an underlying gut issue going on, that when you can then get at that problem and start to look at what's happening in the gut and use something like functional lab testing to find out what's out of balance, then you kind of have, you can move forward from there and address the issue and not just kind of cover it up with a topical or cream.
Yeah. Well, and I think that's a perfect example. And like, I have my own personal testimony of how that's changed, like I had that problem, eczema all over my hands. I couldn't wash my hands. And
it impacts like every area of your life.
Yeah. And I got a steroid cream and like, that's what they gave me, put it on.
You're like, this is your story.
This is it.
I didn't even know too.
So true. With my third child, I had scabs all over my legs. Like they would ooze and bleed. And I would have to wrap my legs in like gauze or ace bandages at night because otherwise it's kind of gross. This is a little bit TMI, but like, so watch out listeners, but they would stick to the sheets and then I'd like,
and then try and be pulling it off. And that has to hurt.
It was so bad. And when I finally realized through integrative medicine and like learning how the whole body impacts everything, and I started changing my diet, my skin cleared up. And like it's huge. And it's not from using creams, and it has everything to do with restoring the health in my stomach.
Right. And that balance of what's going on.
Right. And the doctors don't talk about that.
Right. And I remember like back being like, oh, like your body has to be in balance. Like that sounds so silly, but I'm like, no, that makes so much sense. Like back working in the ER, like when you looked at someone's lab work, like they were coming in acutely ill and you're looking at their labs and they're like, oh, your potassium is off, like super low. No wonder you feel like crap. And, your heart rhythm's looking like that. It's like, because we are meant to be in balance. And it's like, it may not be at the point that you're acutely ill in the ER, but it's like, it's still impacting you and it's impacting your health. And if it's not addressed, it's just going to keep on progressing.
Absolutely. Yeah. So, all right. So the integrative health really helps people look at the body as a whole and see what's going on all through all the different systems and how could it be impacting other areas. Right. And okay. So then, when you're in this arena working with other people, I know sometimes people want to be fixed. Like they're like, can you fix this problem? We're used to that like immediate thing. But I'm curious, what do you wish people did come in and ask, or what do you wish they were asking besides just, can you give me all right, don't give me a prescription, just give me an herbal remedy. And
it kind of takes that like greenwashing. It's like, well, I'll swap out the pharmaceutical for like that herbal supplement. And you're like, no, that's not what I do. So
tell me a little bit about what you wish people would ask instead.
I think just what may I not know, like, what am I missing as far as how can I find out like what may be out of balance going on in my body? And that's like, I will often do with my clients come to me, like say, like you shared, like, I love working with moms, especially moms who've got young kiddos coming in. I feel exhausted, fatigued. I feel like stress, anxiety. I feel like I'm snapping at my kids. Like, this isn't me, and going to their doctor and saying, your lab work looks great. Like, it's in your head kind of thing, but being like, okay, what other tests are out there? What's available? And even just functional lab testing. So one thing I often do with my clients is something called a hair tissue mineral analysis test. So it's taking a sample of your hair and analyzing that and looking at your minerals and nutrients in it and seeing, okay, do you have, really low levels of something? Do you have really high levels of something that are impacting that imbalance? Something like magnesium that's used in so many different processes throughout the body. If you're deficient in that, it can then be a trickle down effect to everything else. So just kind of what other options are available to look at.
Yeah. Yeah, that makes so much sense. Um, you talk about moms that come in feeling fatigued, and I'm just processing this through my own experience,
You're
through
like,
this.
I've
I'm
lived
like,
that.
yeah, I went to the doctor feeling like this is not me. I'm stressed. I'm discouraged. Da, 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 da. He's like, oh, you just have postpartum depression. And I was like, okay. He's like, you're going to get through it. Well, I didn't get through it. And then he was like, let's put you on antidepressants since you're not doing so well. And praise the Lord, my husband was, he just prayed. He was like, he was praying about it. And he heard about something. He was like, Mary, I really think you ought to go on a juice fast. Now, I didn't know anything about integrative health at the
Yeah.
time, but I did. I went on the juice fast, and looking back, I know now that my
What
body
difference that
was
made.
significantly depleted of certain nutrients that I got through that experience, just like high concentrated levels.
Right.
And I haven't experienced depression again. I'm so glad I found out before I went on
Took that
medication.
path and approach.
Yeah.
And it's so
Yeah,
true
so
because you
valuable.
just grown a baby for how many months and your
Right.
body was using all that up. Your
Yes.
growing baby's using all that up. And then you come out of pregnancy incredibly depleted in so
Right.
many things.
Yeah.
And
And
that's like the difference that I noticed between my first one and then my third one, because I'd had, in that 5-year period, or well, I guess they're 4 years apart, like I'd had such a change and like just perspective, like a new way of looking at things, like how I did things with my third was so different than what I did with numbers 1 and 2. And it's like, I noticed the difference,
Mhm.
because I was giving my body what I needed. Like I'd done functional lab testing, knew kind of where I was deficient, and then was able to kind of fill in that and then provide just better overall nutrition. And you notice the difference.
Yeah. Yeah. So definitely this integrative side for moms, I definitely think that that really resonates with a lot of people. Like, how do I get the answers that I need? And this is um, a really good path to go down and consider. I know a lot of people go towards integrative health because they aren't getting answers for their
Mhm.
kids, or maybe they find out, but then they're like, well, your kids need these nutrients, and they're like, my kids won't eat that stuff. Like,
Sure.
so there's like both of these stuff. Like,
Extremes.
great, now I know that they need, a pound of broccoli a day, and wish they liked it,
Right.
that
Now
kind
what?
of thing. So what are your thoughts there for like, how do you help sort of navigate some of that stuff with parents trying to help their kids be successful with various things that they're struggling with?
Yeah, that's a great question. And I love because like my practice that I have now, like has started focusing on helping moms. And then kind of as I worked with moms, like I had more moms coming in and saying like, I'm noticing this in my kid, like, what can we do? So like kind
Exactly.
of
It all
starting to
goes
work on
together.
that whole family, because it's like,
Yeah.
you're right. Like moms truly are kind of the heartbeat of the house. And
Mhm.
it's like everything trickles down from them.
Yeah.
So I love the question because I think it's easy to get wrapped up that I've listened to this podcast, I've read these books, and have all this information. And like, there's too much. Like, how do I know what to do?
Oh my
And
goodness.
instead
Yeah.
of asking that, like, there's too much, I don't know where to start. It's like, well, okay, what changes can you make? So it's like,
Mhm.
does that mean, do we just swap out breakfast? Do we swap out, say, normal cereal and do oatmeal in the morning? Like, is that one swap that you can make? And then what's that going to lead to? Because if you start your day on a strong foot, okay, we have 1 foot forward. Hey, I made a good choice for breakfast. Like, what does that make lunch look like? Could I swap out like one snack instead of, doing kind of the goldfish? Could we do something like some nuts or some popcorn with some fruit with it? Just what's one thing that I can do? Because that one thing is going to turn into something else. It's going to lead to something else. It's a domino effect.
Love that.
And
It's a domino effect. You don't have to figure it all out at one time. You
right,
can just like, okay, I know I can do this one thing and get going on that, so that then that's in coaching we talk about like our brain needs those automatic processes,
right. And it's
right?
like,
So
then you
that
have
we don't have to
evidence. You're
go.
like,
Yeah.
oh, like I did do that. My kids responded and it was okay.
Yeah.
So it's like, okay, what else can we do?
Yeah.
And I love like, so you mentioned like kids not eating things. So I've got a 4 and a 5-year-old. I've gotten pretty good at this now for some tricks. So one thing that I'll usually do is when I'm making lunch or even dinner time, you always have these kids like buzzing around the kitchen. When are we going to eat? I'm hungry. I'm hungry. So like, I will do like their vegetables first, like slice those up on a plate and say, oh, here's like, this, you can get started as you're eating. They're so hungry. They gobble it right up while I'm making, like whatever else is for lunch, if it's like some soup or like a sandwich or something like that. So it's like, you kind of get them when they're at their hungriest and you put it in front of them. Right. Because if you give them a whole plate of things, they're just going to go for what they want. Whereas here's your appetizer and that's what you go for. And even just having things cut up. So like when you bring your produce home from the store, just washing it and getting it all cut, because you as a mom, kids are going to be much more apt to reach in the refrigerator for something that's ready to go. Then I have to wash that, cut it, just making it easy. So that's been some really good tricks that I've used with my clients to help them, get those fruits and veggies and kids.
The appetizer idea is great. I remember my mom doing that. She was trying to teach us how to like okra. Oh, yeah. And we did not love it so much at the time, but she would wait. We were starving hungry. The meal wasn't there. And she'd be like, well, I'm sorry, I don't have everything ready yet, but I do have this pan of okra. If you're really hungry and you want something to eat, we would go over and just gobble it like, yes, please.
I love it. So, and it works. Look, it's still working.
Yeah. It's not 100% across the board, but it's a great starter place to like.
And it's like, even like kind of my role is like 80-20, it's like, if you can 80% of the time, like we are not striving for perfection because that's just setting you up to be discouraged. But it's like, hey, if you can kind of aim for this 80% of the time, like that's awesome.
Yeah. Yeah. That's beautiful. So you've got some techniques and tricks for kids, that integrative piece. So now you told me about how you got to integrative. Now you're a life coach too.
Correct.
All right. So I want to hear that side of the story too. Like, how did you go from, because what that sounds like to people, and I know I have a sister that did this, so it's okay. I'm familiar with this a little bit, but what it sounds like is you're like, okay, I'm going to go into this field and get this certification. And then, okay, I'm going to go into this field and get this like
kind of certification bouncing.
Yeah. Yeah. So how did you decide that both were important or necessary, or what led you down that path?
Yeah. So let me think back for dates. So I started March of 2020. Doing my integrative health certification. And then it was about like November timeframe of 2020. I wasn't done with my certification. It was at your pace. And I was pacing it with two little ones. And I had gone to like this 1-day training, looking at kind of prepping, for 2021 and like your business and what that could look like. I'm like, oh, this is perfect for me because I'm anticipating finishing my certification and I'll be able to have these great strategies going in as I plan my business in this new year, as I get my certification done. And at the end of it, there's just kind of some talk about life coaching and what that was. And I'm just sitting there, mind you, I'm 7 months pregnant at the time. And I'm like, wow, I see like the impact that working with people on their mindset could have like in my health coaching business as I work like with someone as an integrative health practitioner. I'm like, this is craziness. I'm like, I'm about to have a baby. I'm not done with this one certification and I want to start a new certification. And there was just, I knew that I had to do it and that was the time to do it. Yeah. So in the spring, like winter into spring of 2021, I did the life coaching certification, had my youngest in the middle of it. And honestly, like God's timing was perfect. And I look back now and like, that was the time to do it. And then I just kind of hit the ground running and incorporating, my health background and then also the life coaching background and just being able to serve clients, just knowing what's going on physically in the body, but also tying in that mindset because it all comes back to our thoughts and what we're thinking about something leading to what we have.
I want to talk about that a little bit. Like you've seen how the whole body operates, like it all kind of impacts the different areas. How have you in that field seen how, like, can you give me an example of how thoughts have impacted people's ability to heal or their ability to stay on track? What comes up for you when you're working with your clients that way?
Yeah. I'm trying to think. So I think one thing that actually this past week I was working with someone, you often meet people who are like, I've done all these programs, this hasn't worked for me. And so it's like, in a sense, I kind of do have like a plan that I take someone through. And instead of being like, okay, are you going to stick to, they always come, am I going to stick with this? Like, I failed at this. And it's like, so we have this plan in place, but now not only do we have the plan, but being able to work with them and prepping them like, okay, well, what are you thinking about this? Like, where's your mind going when you kind of see like our health plan in front of you? Like, tell me what's going on in your head, and really being able to kind of empty it all out and put it out on the table, find some thoughts that they may not even realize that they were holding on to, that are then going to carry with them and that could be impacting them and their results that they're getting. So really being able to dig into those thoughts, ask, is that really true? And just kind of creating new thoughts with them that they can carry going forward has made a tremendous difference.
Yeah. Yeah. I know. Well, I'm sure we all have those stories of, I'm going to choose this new diet concept here. I'm really going to, and we go in and like 2 weeks in, we're sabotaging it, or we like, I'm just going to cheat a little bit. I mean, and before you know it, we aren't doing it anymore.
And nothing's
it doesn't
changed.
Really, yeah. And it doesn't really have anything to do with a lack of knowledge or a lack of awareness of what needs to change. It's everything in our head
that's happening in our head, and the story we're building up about something. And like, so the client I was working with, she was just sharing like, looking at food she was eating and why don't I have the willpower to do it? And we just started to pick it apart and say, well, if you eat that, like, what does that do for your body? What if we looked at food as like, what does this food do for my body? Is it building me up? Is it nutritious, dense food that's going to satisfy me and give my body what I need? And that was just like the light bulb moment for her. And she's like, you know what? I don't even have cravings anymore because I just think that, what does this do for my body? And she's like, it's all gone. It's not even a big deal to like walk past the Oreos that my son is eating.
Yeah. Yeah. It's so interesting to me that so often we'll eat things and not even be aware of how it makes us feel afterwards, and like make the connection
of
that
what's going on.
I will never forget the day that I realized store-bought cake is never worth it.
Like, it looks good. And then you eat it and you're like, that wasn't worth it.
No, it wasn't worth it.
Yeah. And I feel like too, as ladies, don't we like sit there and be like, you ask that question, you're like, is it worth it? Like, someone else eating the cake, you're like, how good is it actually? Because it looks good, but is it worth it?
Right. Well, and for me, the worth it thing, like, it's all wrapped up in emotion, which is why the thoughts.
How's it going to make me feel?
Like, how's it going to make me feel? Am I going to hurt the person's feelings for not eating the cake? This is some poor little kid's birthday cake, and here I am not eating it. Are they going to notice and be upset that I'm not? What if everybody was making the decision that I'm making and choosing not to eat their birthday cake? Wouldn't that hurt their feelings? I better go. And we do this to ourselves.
And so much happens of it subconsciously that you have no idea that's going on.
Yeah. Oh yeah. No, I'm not like, let me take notes of all the things.
Right. But that's so true. And that's for everybody.
Yeah.
So to be able to recognize like that thought process that's going on as a life coach, seeing patterns across like kind of someone's health history and just what they've tried, what hasn't worked, what has worked, it's given me this whole new perspective going in to be able to really help them succeed.
Wow. That's so powerful for the people that you help. That's amazing, Kori. That's really great.
Yeah, I'm loving it. It's like, I'll get off calls and I go to my husband, I'm like, how did I not know that this was like an option? Like, this is amazing. Because it's like, I loved what I did working in the ER as a nurse. Like, I know I made a difference and, just provided comfort and support to people at some of their scariest times in life. But like, to know that what I'm doing now is like truly transforming their lives and that they're becoming different people through the changes that they're making, and really going through the coaching process.
You're helping them stay out of the emergency room.
Yes. Which is so needed right now, just because that ER is like becoming everyone's healthcare system of like, it's a primary office in a sense.
Yeah. Yeah, it really is. And, and just more and more, it's becoming something that's just used for whatever is the problem.
Right.
Yeah, definitely. I'm a little curious here. How you're doing this for other people as a job. I'm curious how these things have transformed your life as a person. Surely they've kind of integrated into your own family. And
Yeah.
so any thoughts there around how it's helped you and your family thrive?
Yeah, great question. I'm just thinking too, like I think I mentioned before, like the difference between when I had my first and that kind of like postpartum
Right.
experience to the difference between my third was huge.
Mhm.
Thinking like at changes that I've made in our home, a big one and kind of what started it all is Norwex, like that microfiber cloth for
Oh,
cleaning.
yeah.
So that was like another kind of trigger that made me ask why, like, why do you do something? You know, it replaced, because you'd reach for like a chemical cleaner and it's like, this is just what I've always done. But Norwex, starting using Norwex, it made me ask like, well, why am I using this? So just kind of transitioning out like chemicals in the home and getting chemicals out as I learned the impact that they had on our health. So now like it makes me so excited to be like, yeah, like my kids aren't around chemicals that have a toxic impact on their health, you know, that we may not even know
Yeah.
the lengths of. So getting chemicals out was a big one. And then just really changing like eating and, you know, what we bring into our home, what we put into our body, really learning what different ingredients and products are, learning what it looks like to eat whole foods. And then even just kind of having like patterns and meals, you know, at different times throughout the day and just kind of working with the natural rhythms of our body to be
Mhm.
supporting them best.
Yeah. I think sometimes when people, I definitely have talked to people like this, and I've experienced this a little bit myself. Sometimes when we're looking at like, okay, well, I could change up my whole everything that we eat and all that, that starts to get really overwhelming. Or sometimes we'll
Absolutely.
even feel like it's a, um, what am I trying to say? It like it doesn't sound fun. You
Right.
know what
Like,
I'm
why would
saying?
I do that?
Why would I? Yes,
It
yes.
seems
So,
painful. And like all,
right.
you know,
Why
people
would I
want to move
torture
away from
myself?
pain. Like, why would I do that?
Yeah. So, do you ever come across that with people, um, like feel that way? And what do you do?
Yeah, absolutely. I think that, I mean, even for myself, like I remember when I started out swapping out cleaning products, like knowing like I really should take a look at our food and like what's in our food. And it just seems like daunting. I'm like, I don't want to open that can of worms. I don't want to go there. And I think my biggest advice is just like, just do one thing at a time, you know, look at, is it kind of foods in general? Is it, you know, kind of focusing more on whole foods and getting out the processed foods in your home? You know, could you start with like what you have as snacks? Could you start with what you have as a breakfast food? Like
Yeah.
just making a swap. Like, what is one thing that I can do? Because
Mm.
it goes back to that one thing leads to another thing. You know, don't be looking at the big picture, but what's the one thing I can do? You
Yeah.
know, just take a bunch of, it's a
Make it
puzzle.
bite
So
sized
right.
pieces.
Just
Yeah.
take a piece here, a piece here. And before you know it, like you step back and you're like, look at all we've done. Like
Yeah.
I was talking to my husband about that a couple weeks ago. I'm like, you know what? Look at the difference that's changed in our home. I mean, in 5 years, like is significant. Like in 1 year, you know, you're going to have to start to have these wins. And that's what I'll do with my clients is because it's easy to feel discouraged and it's easy to then look at other people and what they're doing and to be like, oh, well, why am I not there? And I'm like, turn around and look at
Where
all
you
you've
come from.
done. Like the only
Absolutely.
person you need to be comparing yourself with is who you were 3 months ago and
Mhm.
look at where you are. And just having that shift, like, you know, you have that huge sense of, wow, look what I've done.
Yeah.
And then
That's
it kind
huge.
of pushes you forward to keep
Yeah.
on going. And like you
Absolutely.
said, you noticed a difference, like just changing what you're eating when your skin
Yeah.
changed. And that's, I'm working with a mom right now who has a younger daughter and they've probably 3 months been making like tremendous changes in the food. And her daughter the other day complained when they went and did like some quick takeout food. And she's like, Mommy, can you please do your home cooked meals again? I don't want to eat that again.
Wow.
And mom was like, I could not believe what she was telling me because it was always, she never ate home cooked food. She'd always complain about it. I want this, I want that. And like, you know, to hear it from her was amazing.
It makes a difference in how she feels.
Right.
Yeah.
Because,
Wow.
you know, at what, 8 years old, like you realize that.
Yeah.
So
That's
it's
so
like what
powerful.
you do makes a difference. And it's like you're going to start to feel it. Like if you just be consistent
Yeah.
80% of the time.
Yes. I love that rule, the 80-20 rule. And you're so right about don't look and compare other people. And I think this applies for so many things in our life, not just diet, not just, anything that we're changing and growing in, to say, okay, let's take a look at where we were 3 months ago, see the progress, and really celebrate that progress that we made. That's what gives us that feeling of, yay, I'm actually doing the thing.
There's changes happening.
Yeah.
Right. Exactly.
Yeah, that's awesome. That's a great takeaway. Well, Kori, I really appreciate you taking your time on the podcast today. Is there, if people are intrigued about what you do or how to get in touch with you, or they want to know more about this, what's the best way for them to contact you?
Yeah, you can find me. I have my website. It's KoriLynnOrth.com, or I'm also in the process of kind of getting Instagram up and running, and that is the Integrative RN.
Nice. Okay. And we'll make sure for the listeners that that's linked in the show notes. They can go over there and click on those links and find you. Listen, thank you so much for being on today. Thanks for having a great conversation about integrative health. So much value and encouragement around just doing the next thing, and that it really is worth going down this rabbit hole, isn't it? Oh my goodness.
Yeah, without a doubt.
Yeah. So thank you for showing up today. I appreciate it.
Thank you, Mary. Bye.
Bye.